Regan the scientist.
That's me! Hi everyone, welcome back to Regan the Scientist. Today we're going to be discussing COVID-19, the new coronavirus disease that's spreading like wildfire around the world. So let's start off with our first question. What is the coronavirus? Well, coronaviruses are a family of viruses that usually live in animals, but sometimes they can jump to humans. When this happens, it's called a spillover. For example, SARS-CoV, or severe acute respiratory syndrome, comes from civet cats, and MERS-CoV, or Middle Eastern respiratory syndrome, comes from camels. So why is it called coronavirus? Well, on the virus itself, there's little spikes that look sort of like crowns, and corona means crown in Latin, so they named the viruses after those. Now, this has been getting a lot of attention in the media, but where did it all start? Well, in December 2019, a group of people in Wuhan, China, all got pneumonia after visiting a live animal and seafood market. Scientists believe that there was a spillover at that market from an animal, possibly a bat, but no one really knows for sure what animal it came from. Since then, the disease has spread to over 150 countries and was declared a pandemic by the World Health Organization on March 11, 2020. The Center for Systems and Engineering at Johns Hopkins University has a map showing all the cases around the world, and I'll link it in the description. Let's go visit our good friend Dr. Addison to tell us about the signs and symptoms of this disease. This is my friend Dr. Addison. She's a real doctor.
Hi guys.
Do you want to tell everyone about the signs and symptoms of COVID-19?
So COVID-19 symptoms are super similar to pneumonia. They are cough, fever, and shortness of breath.
But at least there's tons of vaccines and testing available, right?
Unfortunately, it'll be months until we can develop a vaccine, and there's not a lot of testing available in America currently.
Oh no, that's unfortunate. Well, thanks for that. We'll see you next time, Dr. Addison.
Anytime, Regan the Scientist.
Now that we've discussed the basics of the virus, let's talk about what you can do to protect yourself and slow the spread. Lately, everyone's been telling us to flatten the curve, but what is the curve and how do you flatten it? According to CNBC, in epidemiology, the curve refers to the projected number of new cases over a period of time. So basically, this means the number of cases that they expect to emerge over like a week or a month. And flattening the curve means that there are less new cases, so the curve literally looks flattened on a graph. So what can we do to flatten the curve? Well, make sure to check the CDC website or your local news for more up-to-date information, but here's some things you can do on your own to help. Practice social distancing by staying 6 feet away from people in public. Wash your hands with soap and water. Don't touch your face. And finally, stay home if you can. And here is what you definitely should not do. Don't travel. Don't hoard resources like toilet paper or personal protective equipment. And finally, don't believe every rumor you hear about the virus. Some good reliable sources for information are the Center for Disease Control, the World Health Organization, and Johns Hopkins Medicine. So if we're stuck at home, what can we even do? Let's visit our resident stay-at-home professional, Madison. Hi Madison, we're stuck at home because of the coronavirus and we don't know what to do.
I can help with that. Visit USA Today to find the list of 100 things to do while stuck in quarantine. Here are some honorable mentions. Watch a movie. Play an instrument. Learn a new language on Duolingo. Read a book. Bake something. Or clean your room.
Thanks, Madison. And remember to take breaks from social media and the news because sometimes all those can do is just heighten your anxiety. See you next time!